How do I know the stage of my follicular lymphoma?
So the staging of follicular lymphoma is typically done by imaging. So we will use something called a CT or a PET scan. And the staging, it has to do with how far advanced the disease is throughout the body. For example, if you just have one group of lymph nodes, for example, under the arm, if you only have lymph nodes there and nowhere else, that would be an early stage, such as a stage 1 or stage 2. If you have lymph nodes above and below the diaphragm, for example, lymph nodes in the chest and lymph nodes in the abdomen, we would call that a stage 3. And then if you had disease that was in the lymph nodes and in solid organs such as the lung, the liver, the gastrointestinal tract, that would be a stage 4. But the staging is based typically on imaging or biopsies.
Yeah, so staging in follicular lymphoma and lymphomas in general is I think, different than other cancers, and many people have some sort of personal experience with a family member or a friend that has a cancer diagnosis, and then they get told a stage. In lymphomas, most lymphomas we see, including follicular lymphoma, are going to be what we call extensive stage. So the staging is a little bit different than other cancers. Also, we tend to use what's called a Ann Arbor stage or a modified Ann Arbor stage, and it really looks at where in the body lymph nodes are, basically at diagnosis. So that can range from just a single group or one lymph node. Somewhere I'm pointing to the neck because there's lots of lymph nodes in the neck, or multiple lymph nodes kind of on the same side of the body. And we usually use the diaphragm muscle, the breathing muscle, is kind of the cutoff for that. And that would, if it's a single area, that would be stage 1. If it's multiple areas on the same side of the diaphragm, that would be what we call stage 2. If it's beyond that, in multiple lymph node areas, that would be stage 3. And then if it's in organs that are not sort of lymph nodes or the spleen, things like the bone marrow or liver or lungs, we'll generally say that's stage 4, which is kind of the maximal extent for that staging classification. There are things sometimes we'll ask patients and discuss and incorporate into the staging schemes, or whether they have what's called B symptoms. B symptoms are things that come up as part of the body's reaction to lymphoma being in the body. Most often those are things like night sweats, like really drenching night sweats where patients have to change their clothes, or bed sheeting, those sorts of things. Sometimes with that can be elevated temperatures, so fevers. Sometimes those things will cause patients to lose weight, and so we have criteria around that. And so often you might see, in clinic notation or in a consultation, a stage, which, say could be Ann Arbor stage 2, but also a B symptom. So, it could be stage 2A or 3B. It's these combinations of different staging schemes. The other thing that we look at that's beyond stage, again, because most patients are, advanced stage, that's actually less important for prognosis. It doesn't necessarily change how treatable or how long a patient's going to live or how they're going to do with a lymphoma. We can turn to other kind of prognostic schemes, and usually those use some combination of the stage and then things like laboratory values, like whether the patient has anemia or an elevated lactate dehydrogenase level. And so we get into these other kind of prognostic schemes. There's some calculators you can use for things like the FLIPI score, which is Follicular Lymphoma International Prognostic Index. Many of these things are very sophisticated and actually evolving even as we speak. But those are things patients may also additionally encounter in terms of their journey with follicular lymphoma.
Yeah, that's a really important question. There are two things that I would like to emphasize. So first of all, the way we stage follicular lymphoma is through a specific staging system called Ann Arbor staging. So if patients have lymph nodes only on one side of the diaphragm, and the diaphragm is the big muscle that divides the chest from the abdomen, if they're only on one side, we call those stage 1 or 2. 1 usually if it's only one lymph node, 2 if it's more than one, and that's early stage. If it's on both sides of the diaphragm, or if the lymphoma goes outside of the lymph nodes, typically in the bone marrow, then we call that stage 3 or 4, so more advanced stage. However, one thing that is really important to know is that differently from solid tumors, where stage can meaningfully affect life expectancy, the same doesn't hold true for lymphoma in general. So in B-cell lymphoma, definitely those who have early stage may have overall a better outcome, but life expectancy doesn't change meaningfully. And usually staging is more a piece of information for us to know whether radiation would be part of treatment. I'm saying this because understandably, many patients with B-cell lymphoma, and particularly follicular lymphoma, who get diagnosed the first time, and they read on their charts that the lymphoma is a stage 4, they immediately think of stage 4 lung cancer or stage 4 colon cancer. But that has a completely different meaning. That's something that we always emphasize to our patient when we meet them for the first time.